Well, thank you, Dylan. There's also a growing fear of a second wave of infections in South Korea, despite it being one of the countries that had earned global praise for its response to COVID-19.
The new outbreak stems from a new cluster traced to 5 bars and clubs in Seoul's nightlife district of Itaewon. The number of cases linked to this cluster was at 101 earlier today.
Some of these clubs are frequented by gay customers who may not want to be identified. So let's bring in South Korea correspondent Chang May Choon in on this discussion. May Choon, South Korea's success in flattening the curve has been largely due to its testing, from screening clinics all over the country to its innovative drive-through testing booths. So this come forward and get tested strategy has relied on people's willingness to get tested, but do you think it will work in this particular instance?
Okay, this time we know that the center of the outbreak is 5 pubs and clubs in Itaewon, and the authorities have managed to get a list of the customers who went to the clubs over the long weekend, which was April 30th to May 5th. So in this list, there are 5,000 people, and the authorities have not been able to contact about 3,000 of them. Worried that people might not want to come forward because, of sensitive. They don't want people to know that they went to these clubs. The authorities started to promise that they will allow anonymous testing. So they encouraged people to come forward, and then they told them that your identities will not be compromised. And they've also tried to tell people that if you do not go for testing and in the end you get found out, you can be fined. So with these two measures in place, today the number of people going forward for testing have increased. So Mayor in a briefing this morning said that the number of people who went for testing has doubled. And I'm seeing queues at testing centers. So that means people are more willing to come forward to go for testing now. And it's not just the clubs. People who went to the clubs could have gone to eat at restaurants in Itaewon area. So they're asking those people to go for testing as well. And every day we get messages from the central government, sent directly to our mobile phones, telling everyone, urging everyone to go for testing. So I think that will help.
Right. May Choon, how would you then describe the new outbreak? Is it under control, or could it lead to another wave of infections in South Korea? Now, we understand there are 8 military personnel among the new cases, as well as a super spreader nicknamed Yongin 66.
Yongin 66 was the first case to be discovered, and after that the number of cases started going up. So as of now we have got 101 cases. If you compare this to the previous outbreak, which was linked to the Shincheonji Church, the numbers are a lot smaller. Shincheonji, the total number of members that actually went for testing is over 200,000. And then that, from that you see the figures, the number of infections so far is 10,000. But here, what we have is the authorities managed to get a list of people. The list is, let me see, it's only about 10,000. So it's a fraction of the previous one. So the the number of people exposed is not so high, and then the rate of infection, how fast number of cases are emerging, seems to be quite low this time around. So while they are worried that this will lead to a new wave, the numbers seem small at the moment, and we have to wait and see because the incubation period of the virus is about 14 days.
Right. Well, in response to this new outbreak, Seoul has shut clubs and bars again. We understand museums and libraries are still open though. And professional sports have also restarted, and spectators are actually allowed in the stadiums. Are these and other venues that have reopened slated to close one more?
We're not sure now, but the government has said several times that if the number of cases suddenly go up, or if there's a second wave, they will revert back to the strict social distancing measures in the past 2 months. So there is a chance that these public places can be closed once again, but they've also highlighted the fact that in the open spaces, well-ventilated places, these are less likely to be like a hotspot, a breeding ground for the virus, compared to a place that is very crowded, poor ventilation. So when you look at the clubs in Itaewon, those are actually hotbeds because a lot of them are underground. There are no windows, and then people let their guard down when they go clubbing, so it's easy for the virus to spread.
Mention now, barring another extension, Singapore's circuit breaker will be in place until June 1st. And even then, Minister Lawrence Wong said that restrictions will be lifted gradually. So as the June 1st deadline draws nearer, what lessons can be gleaned from the situation in South Korea?
Okay, in South Korea, it was the number of cases started. The new cluster emerged after a long weekend. The long weekend, April 30th to May 5th, had 3 public holidays. So people let their guard down. They became complacent, and then as the numbers started going down, the number of new cases started going down. People started to feel like, we can go back. Our life can go back to normal, right? So as they were waiting for the government to ease social distancing, a lot of them decided to go traveling. A lot of them decided to go, like, it's time to go out. We can have fun right now. They wear masks, no doubt, but you will let your guard down. Like when you go to restaurants, you don't spray hand sanitizers anymore. Or when you go clubbing, you just remove your mask, you drink, you party, you just have fun. So I think the lesson that we learned from South Korea this time around is do not be complacent and beware of the holiday mood. Like when you think that you'll be fine, the virus comes back to bite you again.
Right. Well, fantastic note to end on. Thank you very much, May Choon. Stay safe in Seoul. We've been speaking to the Straits Times South Korea correspondent Chang May Choon on the growing fear of a possible second wave of COVID-19 infections in the country.